respect our marriages and the life that comes from that. So it's something that I've been involved in quite some time, and it's just a really exciting thing to be here. So with the NAPRO physicians, what makes them different from mainstream physicians, especially obstetrics and gynecology, is that they look for the underlying cause of a woman's health issues. The way that mainstream medicine really treats it is a Band-Aid approach. They want to throw something at you to treat your symptom, but they never really get down to the bottom of why you're having those symptoms. And we think of infertility as a disease, but it's really not a disease, it's a symptom of multitudes of underlying diseases. And so to really get to the bottom of that, the Creighton model can be used to identify various biomarkers in a woman's cycle that can indicate what's going on within her, so we can get accurate testing and accurate diagnosis and accurate treatment for them. So it can be anywhere from just gynecological issues to treatment for infertility. And the treatments for infertility are in accordance with the church because they're just restoring the health of the woman. And it respects it. And it's actually more successful than IVF. It's 1 to 3 times more successful than IVF. Unfortunately, a lot of women just aren't aware that it's there and it's available. So I really want to get that out more. And I commonly hear women say that a natural system can't work for them because they're breastfeeding, or they have irregular cycles, or they're premenopause. There's a gamut of different things that they may say, and they truly believe that they can't use a natural system, but that's just not true. The Creighton model specifically can be used for any reproductive category for a woman, even if she's anovulatory. There's something that's causing that, but she may have a cycle occasionally where she does ovulate, and so she needs to be able to know and recognize her fertility when that occurs. And this system is highly effective for these various situations as well. So it can be used with regular cycles, irregular cycles, while breastfeeding, anovulatory states, post-pill where the pill is still affecting your cycles, we can still help you navigate through those, perimenopause or any other situation. And I also hear women say that they have to be on the pill because they have endometriosis or PCOS, and they think that they need to be on it to regulate their cycles. They've been told by a physician, oh, you have to be on this to regulate your cycle. But we really need to figure out what actually is going on with them. And this is just another example of how mainstream medicine just slaps a Band-Aid on our symptoms and doesn't actually figure out what's going on with us and how to treat it. And this is particularly an issue with PCOS. These women are at high risk for diabetes, heart attack, stroke, cancer, and left untreated, they stay at high risk for all these things. So their hormones really need to be evaluated and their health restored so that they can have a nice, healthy, normal life. And I also like to point out, most women just really aren't aware of this, but whether you're breastfeeding or bottle feeding, ovulation can occur prior to your first menses, 30% of the time, roughly. And this is very, very important because most women do not think their fertility returns until after they have that first period. But that's just not true. And so being aware of that and being aware of, oh, I can use these natural systems while I'm breastfeeding so I know when my fertility returns so I can plan my family effectively is very, very important for women to be aware of. And breastfeeding women, too, can see a variety of different things within their cycles. They can have completely dry cycles. They can have mucus patches here and there, or they can have continuous mucus. In any of these scenarios, they can still use natural methods. They're still highly effective for these women. So we don't want this misinterpretation or misinformation to really be the driving force for why a woman is choosing something else. We want her to really be aware of her options. And breastfeeding is great for suppressing ovulation if you're fully breastfeeding, but it works differently in each woman. So one woman may be able to successfully have ovulation suppressed until she weans her child, whereas another one, it doesn't matter, her fertility may return. And it can vary from, even after each pregnancy, it can be different. So realizing that is also important. And the first 3 cycles after a woman starts menstruating again can be very irregular, and it takes a while for the hormones to jump back into play like they're supposed to. Unfortunately, this creates a higher risk for miscarriage during those first 3 cycles. So I also help evaluate these cycles and let them know, okay, your cycles are healthy again. And the women who use the system with their spouses, they're able to identify these biomarkers as well. I'm able to train them to be able to monitor their own health and let me know when something pops up in a cycle, and I can help guide them to be able to get help. I personally started using Creighton when I was a single college student for medical reasons. Unfortunately, I passed out every cycle from severe pain, and I went to several gynecologists, and of course their first question is, well, do you have regular cycles? Yes, I had regular cycles. I had normal bleeding. But I had this really bad pain, and I was about to fail out of college because of it. So it was really interfering with my life. And their solution was just to slap me on birth control. And I want to know what was going on, and I asked them if they thought it was endometriosis. And their first question is, well, do you have painful intercourse? No, I don't, because I'm waiting till marriage. So they just automatically dismissed me, and that was really frustrating to me. But I felt like I was one of those women who was pressured into having birth control for medical reasons because I couldn't fail out of college. But luckily, I have a family member who is also a fertility care practitioner. I wasn't at the time, and she let me know, oh, you need a start chart and you need to get this evaluated. And I had several issues wrong with my cycles. It didn't matter that I had 28-day cycles. We figured out that I had several issues going on, one being endometriosis, and I had pretty extensively. But we also, as a college student, I was able to see these biomarkers that made me at risk for miscarriage. And so I was very, very grateful to know that beforehand, before trying to build my family. And my husband, he just walked into this just trusting it. He's like, this is what the church teaches. You seem to know what you're doing. Okay, we'll do it. And he is my biggest advocate. He'll talk to anybody about mucus, which is really interesting. So if they ask, what does your wife do? They're in for a loaded question or a loaded answer. So I also teach adolescent girls. I was a single young girl when I started learning, and I will teach from young girls 9 who are just about to start their period or just have all the way up to women who are premenopause. But the reason I teach young girls is to help them gain respect for their bodies and their fertility, and to instill the purpose of chastity and affirm it, and really give them an appreciation for their design and the design of their body. And we really do not see a high incidence or a higher incidence of these women or these young females being sexually active. They actually really do embrace their chastity. I really, really enjoy teaching these young girls. There's just so much that they don't know, where their mothers and fathers can't give them answers. And I also really like to teach them too, because their mothers don't realize that their cycles can be irregular for their first 10 cycles. And the family doctor is very quickly to, oh, she has irregular cycles, let's put her on birth control. But there's nothing wrong with her right now. It takes her body a while to start producing hormones like they're supposed to, so her cycles function properly. So I help them work through that and monitor it and understand the changes that are occurring. Then I also just like to mention that there is a preconceived notion that I have couples walk in or people that contact me and misinformation about natural family planning. And one is that they believe that the frequency of the marital embrace is much lower. It just has to be with the natural system. But there's studies that show that 75% of couples who switch to a natural method actually have a higher frequency of the marital embrace. And really enhances communication between the spouses. And the mucus sign is what Creighton is built off of. It's very, very reliable. It's actually one of the most studied biomarkers of the cycle, and ovulation has been correlated very highly to the observation of that mucus. And it's been correlated with hormonal studies, basal body temp studies, and ovulatory series studies as well. So it's very, very reliable for that. The way Creighton is specifically set up